The topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. As always, my goal is to empower you with information to help you regain control of your health. Does food really matter when it comes to cancer? You bet it does. There are things we can do to change our internal environment to one less hospitable to cancer and to boost the efficacy and treatment and mitigate the side effects. The goal is to heal and to reduce the opportunity of recurrence or new cancers, and that is right, to survive and live well. Yes, food as medicine is a key player. So I'm sitting here today with Dr. Mitch Gaynor, founder and president of Gaynor Integrative Oncology here in New York. Dr. Gaynor is author of 4 bestsellers focusing on healing, health and the environment, and cancer prevention. Dr. Gaynor is also a longtime promoter of the healing power of sound. One of his inspirational books, The Healing Power of Sound, offers techniques to access deep states of relaxation and awareness and to promote health, not disease. He is deeply involved with integrative solutions for cancer and has been implementing sound and music therapy as part of his treatment protocol for over 25 years and has produced several healing CDs. This past summer, Dr. Gaynor's newest release, Change Your Mind, Music for Brainwave Entrainment, debuted at #1 on the Billboard's New Age Albums chart. The album also topped Amazon and iTunes New Age charts. But most of all, Dr. Gaynor believes that there are concrete steps that can be taken to lower the risk of cancer on all levels. He believes we can create a healing environment that reduces the use of toxins, promotes healthier nutrition and detoxification, and enhances immunity. Even if we are overexposed to environmental toxins, and even if we have unfavorable genes, there are still nutritional modalities, stress reduction, and things that cause epigenetic changes that will help offset these conditions. So with great pleasure, I welcome Dr. Mitch Gaynor to today's show. So nice to have you here, Dr. Gaynor.
Oh, great to be with you, Elyn.
Well, thanks for joining us here. So, Dr. Gaynor, if you follow the media, you could easily conclude that with early diagnosis and all of the drug therapies that we are winning this so-called war on cancer. But yet so many cancers are on the rise and so many battles lost. So do you think we are being misled by the media?
Well, I think that the whole story is not being told. And, whenever you're just focusing, on the part rather than the whole, you tend to draw the wrong conclusions. And, the fact of the matter is, when I started out 25 years ago with my practice and my research, 1 in 3 Americans were going to develop cancer. We're going to hear the words, "you have cancer." And it was predicted then by the year 2050 that it was going to be 1 in 2 Americans. We're going to beat that date. It's almost 1 in 2 right now. So if that's not the definition of an epidemic, I don't know what is. And if you look, at things from, childhood brain tumors, to a number of other cancers, there are more of them, and it's not just early detection that we're picking those up. There are a number of other factors. And so I think, one of the major things I focus on is the fact that really by the time somebody's in their 20s, they probably have dormant cancer in their body. And we know that from autopsy series of people who have died, of auto accidents or wars, and they do autopsies of people in their 20s, and they find dormant cancer. It could be in the thyroid, the breast, the colon, the lung, But the fact is it's dormant, but they're walking around with it. And humans are the most rapidly evolving species on the planet. We're exposed to environmental toxins that our grandparents never were. And so, this is, just part of what we have to contend with. And a lot of people feel very helpless because of that. They think, well, I've got the genes I was born with. I'm living on this planet. There's nothing I can do. But nothing could be further from the truth, because while we can't control the genes we have, we can control the expression of those genes. And that's really what I've been interested in for more than 25 years. When I was doing my fellowship at Cornell and research at Rockefeller University, and looking at nutrient-gene interactions and toxin-gene interactions, I really saw how there were toxins that could turn on genes that could promote cancer. There were different nutrients that could counteract that by turning on genes that would suppress cancer. And so that's been a big part of what I've done the last 25 years.
So what you're saying is we have our gene situations. Are we born with our genetic destiny? You say no. You say it can be changed. What kind of nutrients would you target to change the way our genes behave?
Well, there are a number of things because there's so many different genes that are important in the development of cancer. So if you really, start to look at some of the most basic things, it's our detoxification genes. So everybody has genes in every organ in their body. They're most abundant in the liver, called detoxifying genes. And one of them has a very, long name. It's called glutathione S transferase. But there was a very nice study done out of Johns Hopkins by Kathy Helzauer several years ago, and she looked at women with and without breast cancer. And she found that women with the lowest levels of the most common detoxifying gene called GST had a fourfold increased risk of developing breast cancer. And numerous studies have supported similar findings in people with low detoxifying enzyme levels in their lung, having an increased risk for lung cancer at an early age. So your detox genes are really your first line of defense against all the residual pesticides, herbicides, on foods. A lot of the other pesticides or toxins that are found in water and the air we breathe, like dioxin. And so you've got to get rid of these things. These things can get in the body, and they can stay there in fat tissue and breast tissue, other tissues, literally for decades. And so there are a number of foods you can eat to increase on a genetic level your body's production of these detoxifying enzymes, and those are things like garlic. There's a nutrient in cruciferous vegetables. It's called sulforaphane, and the cruciferous vegetables are like broccoli, Brussels sprouts, cauliflower, cabbage. That increases on a genetic level the body's production of detoxifying enzymes. Turmeric, which is what gives curry its yellow color, increases the production of detoxifying enzymes. And omega-3 fatty acids that are found in cold, deep water fish, as well as flaxseed and hemp seed, pumpkin seed, those will increase the body's production of detoxifying enzymes. So that's just one thing. Then another very important thing is nutrients that will facilitate, any cancer cells you have going back to dormancy. In other words, not becoming active. So, my philosophy at Gaynor Integrative Oncology is really twofold. If people are seeing me for prevention and wellness, then it's to make sure that any dormant cancer cells in their body stay dormant. If somebody already has an active cancer, then the goal is to make the active cancer cells go back to dormancy, to make the body into an inhospitable place for cancer. So the big difference between a cancer cell and a normal cell is a cancer cell just keeps dividing. It does not die when it gets old. A normal cell, say in the lining of your colon, when it gets old, it'll die and make room for new cells. That process of programmed cell death when a cell's old and it's already done its work is called apoptosis. So there are a number of nutrients that help cells regain that ability to die, not to keep on dividing, to undergo apoptosis. And there are a lot of nutrients, for instance, in black raspberry. Black raspberries are loaded with nutrients that turn on what we call tumor suppressor genes that facilitate apoptosis. There are also nutrients in grape skin, like resveratrol. That facilitates apoptosis. I mentioned turmeric for detox earlier. That's what gives curry its yellow color. But also, that facilitates apoptosis, the normal death of cancer cells. And there are nutrients in soy that facilitate apoptosis. There are nutrients in green tea that facilitate it. And then one of the other big things that cancer cells are very good at that we want to be able to counteract is angiogenesis. Angiogenesis is the formation of new blood vessels. Now, you need normal angiogenesis. If you cut yourself, you need to make new blood vessels to heal. If you have surgery, you need to make new blood vessels. But cancer cells are very good at stealing the blood supply from normal cells, and that's how tumors grow and they spread. That's a very abnormal type of angiogenesis. And what I mean by that is if you look under the microscope at those blood vessels that around cancer, it's really a very dysmorphic, irregular array of blood vessels. It's a completely different process than normal angiogenesis. If you look at normal angiogenesis, like after a surgical procedure, it's a very smooth array of blood vessels, very orderly. So it's a very different process. There are a number of nutrients that will interrupt and interfere with abnormal angiogenesis, and those include, so there are a lot of abnormal angiogenic nutrients, like resveratrol can help with that, and there are things in coconuts that will interfere with that, especially. So I use a lot of coconut milk powder with people. That helps to interfere with that. There's a nutrient in magnolia called hanakyle that can interfere with abnormal angiogenesis. And then there are more common things in milk thistle that interferes with it, and beets that interfere with it. So, it is really a very, very comprehensive approach. And the good thing is a lot of these nutrients have a lot of other beneficial effects on other parts of the body. Right. And the other big thing, that people are reading about in the newspaper and they see probably in their own families is this massive increase in type 2 diabetes, adult onset diabetes and pre-diabetes, people with metabolic syndrome, where they have that midline gut, they start gaining weight, their sugars aren't in the diabetic range, but they're a little high, their insulin levels are higher. Well, every study has shown, and these are huge studies published in the New England Journal of Medicine, with every 10% above your ideal body weight a person is, the risk of developing and dying from cancer goes up markedly. And so with a lot of the processed food we're eating today, a lot of the refined sugar, a lot of the refined flour, there's just an epidemic of this. And so what happens is every time your body is making insulin to metabolize sugar or carbohydrates, and it has to make more insulin for the refined sugars, the refined carbs, the white flour, your liver at that time is making something called IGF, or insulin-like growth factor. That's a huge tumor promoter. And we know women with the highest circulating insulin levels are much more likely to get breast cancer. men with the highest circulating insulin levels much more likely to get prostate cancer. And so that's another thing that we really work with is, how to eliminate those types of foods from your diet and lower that. And I also use a lot of a drug that's very, very old. It originally came from an herb called metformin. And metformin originally came from the French lilac. That was an herb that had been used for about 300 years in European folk medicine to treat diabetes. It became a drug in Europe first in 1955. And they noticed over the ensuing decades that people that were on metformin had 40% less cancer overall than everybody else.
Right, and you would say too that was a rather safe drug. There's many people who look to stay away from it.
Very, very safe drug. I mean, it's one of the safest, and it's so amazing because even in low doses, it can lower insulin-like growth factor, and we use it a lot now for prevention. People that are at a higher risk of breast cancer or prostate cancer. And an amazing, quite surprising study. They did a study that was published in the biggest oncology journal, the Journal of Clinical Oncology, a few years ago. And they just wanted to see how diabetic women with very, very large breast cancers that were too large for either a lumpectomy or a mastectomy that needed to get chemotherapy first to try and shrink it down to make them operable. They just wanted to see how do diabetic women do with this. And so some of the women were on insulin, and some were on the newer anti-diabetic drugs like Actos and Januvia, and some were on the very, very old metformin. And to their surprise, even though they weren't looking for this, when they went back and analyzed the data, they found that the women who happened to be on the metformin had an almost threefold increased pathologic complete remission rate with the chemotherapy compared with the women on either insulin or the other anti-diabetic drugs. And pathologic complete remission means when the surgeon went in there to do the surgery, there was no trace even under the microscope of the cancer. So then that started generating a lot of interest, and it's since been found that metformin can turn on a number of very powerful tumor suppressor genes, and it makes your body more efficient at metabolizing sugar, so you need less insulin. Less insulin means less insulin-like growth factor, which is a tumor promoter, being produced. So, there are just a number of things you can do on all these different levels. You can optimize your detox system. We haven't talked about the immune system yet, but that is a huge thing that we can measure because there's a part of the immune system called your natural killer cells. That's your main line of defense against cancer. So you want to keep those strong. Not everybody's are. And, there are a number of mushroom extracts that I use, like about 10. There's maitake, there's shiitake. One of the most powerful is chaga mushroom. Chaga mushroom it grows on birch tree bark. And it's an amazing thing with nature because the birch tree bark contains all these nutrients that are not usable by humans by themselves, but the chaga will extract them and make them into a more usable form, and it has a number of very profound anti-cancer effects. And then there are other things we can do to keep the immune system strong, other body systems strong, even with mushrooms like cordyceps, which is very good for the lungs, and turkey tail, reishi mushroom. A lot of these, are very important. And then another very important, part of this whole equation, with the immune system and everything is vitamin D, specifically 25-hydroxy vitamin D. Everybody should know their levels. And your T cells, your natural killer cells, can't work without enough vitamin D. So we've known for years that people with the lowest vitamin D levels had the highest rates of breast cancer. And then a study came out a few years ago showing that women who were diagnosed with breast cancer, they the ones with the lowest vitamin D3 levels, 25-hydroxy vitamin D levels, when they were diagnosed, had about a 90% increased chance of developing metastatic disease. I mean, it's huge.
Wow, that's right.
It's
such a small thing to do. Just
such a small thing.
Thing to do.
You're talking, pennies a day for something, but you have to know your level. You can't guess. So, some people don't absorb it well. They need a lot of vitamin D3, and some people do absorb it well. But here's the thing that the people need to understand. If you eat a great diet and you're living like in the New York area where, between November and April we're not getting much sun, so your body's essentially not making any, you need to supplement with it. So if you eat a perfect diet for vitamin D3, if you're eating salmon, if you're eating cottage cheese and enough dairy and everything, really the most you could get dietarily is 350 units a day. The least you need if you're living, in this latitude, you need about 2,000 a day. And
right, and keep in mind, everyone, that's if you absorb it well. If you don't,
then like somebody like me, I'm not a good absorber of vitamin D, so I have to take like 50,000 units a week, several weeks a month, just to keep the level in the mid-normal range.
Right.
So everybody's different.
Mm-hmm. Okay, so we talked about, you say that most people are walking around with dormant cancer and that the goal is to keep that dormant cancer dormant. And you spoke about the immune system and detoxification and our glycemic load and vitamin D levels. What about inflammation?
Inflammation is hugely important. And a lot of people know they have inflammation, and a lot of people don't know it. So, the people that know they have it are people with like irritable bowel syndrome and, chronic arthritis, or, people that have had, recurrent bouts of Lyme disease, people that have had, recurrent infections somewhere in their body, or they're diabetic. A lot of people know, they have inflammation. But there are very good markers we can measure in the blood. A lot of people don't know they have inflammation, but they do. And sometimes it's due to bacterial overgrowth in the stomach. Sometimes it's due to leaky gut. Sometimes it's due to too much caffeine and alcohol or other toxins. You can measure, with C-reactive protein and other inflammatory markers. Very important to know, because the two strongest promoters of tumors are produced when there's underlying inflammation. One is called NF-kappa B, and the other is called AP1. So inflammation in general can promote cancer, and that's one of the things about cancer treatment is, when we use chemo, and I'm an integrative oncologist, and I'm not alternative, so integrative means, I'm using, the best that modern medicine has to offer, but I'm also realizing that, most of what we call modern traditional allopathic medicine, it's just treating the symptom. So you have a stomach ulcer, you get, Nexium or Prilosec, but you're not looking at the underlying cause so much.
That's
Why
right.
does the person have the stomach ulcer? If you have breast cancer, you may go to a surgeon, have surgery, radiation, chemo, but it's not looking what are the underlying causes? Why did that cancer develop in the first place? So what integrative is we're really, I believe we have to treat the symptom. We have to use chemo to a degree, but we also have to do everything to look at the underlying imbalances in immunity and inflammation and abnormal angiogenesis and those types of things. Because one of the biggest things that creates inflammation is, when you're getting chemo, you're killing cancer cells, they break apart and they're releasing all these inflammatory markers and mediators. That's been proven. And the other thing that chemo's been sorely ineffective at is getting rid of cancer stem cells. Those are the earliest types of cells. In fact, sometimes after chemo you have more cancer stem cells. Two things that have been found to be helpful in eliminating those, and there's good data for that, is turmeric or curcumin, as well as metformin. So really, a more comprehensive, integrative approach, I think that's definitely the future, and clearly the goal, if you are lucky enough to be able to choose that, is to never get cancer in the first place.
Well, of course, but if you do have it, you make a very big point here, and I just want to, really stress that to everybody, that the difference between oncology and integrative oncology is mostly treating your symptoms, and integrative oncology is getting to treating the symptoms, but is also getting to the reason that you have a symptom, getting to that root of the problem. And without getting to you don't get to the root of the problem, you're just going to forever be reacting to the results of it.
Right, and whatever the underlying causes were that created that initial cancer, if you leave those there, it's just something else is going to develop.
Right, just going to grow. Okay, so any more on our dormant cancer? No, but we probably should talk a little bit more about the changes that we see from environmental toxins, your BPAs and your things like that, that are also creating dormant cancer, the beginning stages of it. Well,
that's a very important point, and it's also very important because, it's affecting our children to a huge degree also. I mean, I can't tell you how many women, literally almost on a daily basis, that have breast cancer come in and tell me they've got a autistic child at home or a child with severe learning disabilities and things. I mean, it's like amazing, when you really talk to people. And so, we're definitely not living on the same planet that our grandparents were living on. And, since World War II, when all these things started coming out to make our lives better and improve everything, there have been a lot of unintended consequences to all these environmental toxins, the dioxins, the toluenes, the benzenes, and you find a lot of these even when you do breast biopsies and in breast milk. A lot is in there. So that's a very, very worrisome type of thing. And, when they do biopsies from, surgery, even plastic surgery, and you look in the fat, most people are carrying between, 80 and 100, really serious environmental toxins in their body. This is a new phenomenon. There's all these neurotoxins in the environment. The risk of autism, in the 1970s, it was 1 in 10,000 children. Now it's about 1 in 150 children. So, the incidence has gone up, childhood brain tumors. And so, there are a lot of toxins. You just mentioned BPA, which is found, in plastic softeners, even the nipples, children
baby bottle nipples, right.
Are using in baby bottles. Toys and water bottles. So, BPA has been linked, to, a number of different disorders. There's what we call endocrine.
Before we leave that one, though, I just want to say one thing. Everyone is so aware that BPA in plastic bottles, oh gosh, don't use those plastic bottles, but never did I ever think of things like, that it's on toilet paper, copy paper, and other products like that, which I think is something important to mention.
It is, because your skin, you get as many toxins in through your skin as you do in the air you breathe, or, what you're swallowing, food and water. So that is a very, very important point. And, so you really want to go with like green products as much as you can, non-toxic products. I think it's best to use everything as much as you can in your bathroom, on your lawn, green as natural, because you want to minimize the toxic load as much as you can. And, the CDC has published data that 18% of the children in this country now either have a severe learning disability, developmental disability, or emotional disability, before they're 18. It's almost 1 in 5 children. So, there are definitely underlying reasons for this. And then if you look at the epidemic even of infertility, a lot of these chemicals are endocrine disrupting chemicals. There are, 2 pesticides plus BPA that are currently in use now, and they recently did a study called Epigenetic Reprogramming that was done on mice. It was done out of the University of Washington, and with each of these chemicals, when the female mouse who was pregnant was exposed relatively low doses to this, going up 4 generations, there was significant decreased sperm counts in the male offspring after exposure to that. And, so there's an epidemic of infertility
Right.
amongst people today, too. None of these issues, autism, learning disabilities, cancer, none of these are happening in a vacuum. There are, very common reasons, that, and exposures that I believe are, at least in large part, creating these epidemics.
Mm-hmm. Yes, I would say that probably none of us are deficient in drugs, but we are overly exposed to toxins, like you say, that our grandparents and their grandparents were never exposed to, and on a continuous and daily basis.
Yeah, and the thing is, it's going to be very, very important, to sort of change the standards we use. So, for a new drug to come to market, they have to prove that it's safe. But, before they release a chemical into the environment, like with DDT, in the 1950s, they started finding out that was contributing to breast cancer, but it wasn't banned until 1971 after millions more people were exposed. And, that type of thing happens all the time. They, say for those things, you just have to wait for proof of harm. But by waiting for proof of harm,
it's too late.
Millions and millions of people have already been exposed to it. So, it really needs, the whole standard needs to be changed. It needs to be proven safe before millions of people are exposed to it.
Or I think we should, while it's great to spend time and money on the drug therapies, I think we need to fix the problem that we're using all these drugs to fix.
Mm-hmm.
So, that's really what we need to go, back to there. But the devastation you see every day from the harm of all these environmental toxins is horrendous.
Yes.
So, let's go to some current events for a moment. Lately, there's been a lot of talk about antioxidants. So what do you think of all this nonsensical bashing of antioxidants? Here we just talked about all these incredible antioxidants that we can use, and then you pick up the newspaper and it says, oh my gosh, don't do that. Don't take vitamin E. Whatever you do, don't take any of those vitamins.
Yeah, the funny part of that is, most of the things they're saying not to take, I agree with, because, what they're looking at are not things that are based in any science anyway. Most of them are just synthetic antioxidants. Right. God knows where they came from, or where they were manufactured or, sourced, what country. Who I would never recommend those to anybody anyway, yet that's what, everybody's looking at.
That's what they're studying in their studies. That's what they're using.
Yeah, so, right. The example like with beta-carotene in lung cancer in smokers. So they found several years ago synthetic beta-carotene. People who were smokers, it actually increased their chance of getting lung cancer. Well, you wouldn't want to just take beta-carotene as a supplement anyway, because there are a number of carotenoids, but they didn't look, because see, everything that comes out of the ground that's a fruit or a vegetable has hundreds, each one has hundreds of antioxidants, but they do all these other things besides being antioxidants, they support immune function, they support apoptosis, the normal death of cancer cells. They support detoxification. So, even the word antioxidant is, so nonsensical because it's just looking at like 1/1000th of what a substance does. And there's no need. So even when they look at vitamin E, mainly they're looking at alpha tocopherol, which is the least effective part of vitamin E, and they'll say, well, that doesn't do any good, maybe it does harm. Who would use one part of vitamin E. That would almost be like, if you say, okay, I'm going to give you carrot, but, you skin the carrot, and you just give somebody the carrot skin and say, well, they're not getting any benefit really from the carrot. It
right.
makes no sense. So, the mixed tocopherols, have a huge activity like they're found in nature, like in rice bran and everything. So, it's, such, one, it's, so dishonest in a way because, one, there's no such thing as something that's just, an antioxidant unless you want to separate it like they've done in these studies, beta-carotene or alpha-tocopherol, which nobody should be taking really anyway. I don't know why they would ever want to do
exactly.
that. And, a lot of the things that I use, let's say if you take black raspberry powder, that's a very concentrated form of black raspberry. It's all organic, loaded with hundreds of different nutrients. It has some antioxidant thing, but it's, from a whole food, and it does all these things for tumor suppressor genes. It does all these things for your cardiovascular system. It just a lack of, any understanding of nutrition by the people that are doing the studies, and then the people that are reporting them, aren't questioning it. They don't have the background, the scientific background to really understand, well, why would you want to take those anyway? And why would you think, even at the beginning, that those would be beneficial? And then, people write books about it, that antioxidants are harmful and everything. Yeah, well, those particular antioxidants, that are given in a vacuum that are purely synthetic, who would expect them to be good in the first place? But, to make that an indictment, of any food.
To the layman, it's confusing.
Go ahead.
I was going to say to the layman that just confuses everybody so much because they say, well, look, they just came out and said this thing on prostate cancer. Why in the world would you want to take, selenium and E? But what they're, if you're taking garbage, no, you don't want to take that. But as you say, if you're taking the quality and the whole synergistic combination, then yes, you do want to take these things.
Absolutely. So, and that's been, the whole myth about this. Yeah, because it's almost like, a scare tactic for people, and it's based just, on complete misunderstanding of the scientific literature. And, it's really, the studies were done by people with clearly no good understanding of, how nutrition really works in the body. And then, it just gets picked up by the media, probably because it sells newspapers.
And it doesn't really, the studies don't have the best intentions. They're intentionally trying to bash the use of any kind of supplements and antioxidants. So what about the all this discussion on the value of intravenous vitamin C? You want to share your thoughts on the efficacy of that?
It can be very useful in conjunction with other things. I don't use it by itself, but it's very interesting. The way the whole vitamin C, it's almost a continuation of what we were just talking about, like just sort of taking things out. So there was a scientist named Mark Heaney who had published a paper he looked at a substance, vitamin C is also called ascorbic acid or ascorbate. And so he wanted to see what happens if you incubated cancer cells with vitamin C. But he didn't use vitamin C. He used something, a different variety of vitamin C that had an extra hydroxyl group on it. It was a 25-hydroxy vitamin C, which you can't even go out and buy, or ascorbate. And so the cancer cells proliferated more with that substance, and so it got published, and everybody thought, oh, vitamin C isn't good for cancer. Then it was pointed out to him he didn't use ascorbic acid or vitamin C. he used a different chemical. And so he wrote a retraction to that paper, which the editors wouldn't publish. And so, it was sort of like out there. The vitamin C wasn't good for cancer. But the fact of the matter is a lot of literature has been done and has been published in the Proceedings of the National Academy of Sciences showing how cancer cells will selectively take up vitamin C because it's so similar to glucose. If you look at the structure of glucose, which is a simple sugar, or you look at vitamin C, they almost look identical. So vitamin C is taken up by normal cells, like sugar would be, and it's metabolized via something called the Krebs cycle, used to make energy. But by cancer cells, they don't metabolize via the Krebs cycle. They work in a more anaerobic or without oxygen environment. So they take up selectively the vitamin C because it looks so much like glucose, but they can't metabolize it. They metabolize via something called the Cori cycle, so it turns into hydrogen peroxide, which is toxic to the cells. And that's why when you do a PET scan on people, a PET scan is just radio-labeled glucose. Cancer cells like glucose more. They take it up more. And so that's why anywhere there's cancer in the body, you can see it because it looks darker. So it's very similar what's happening with the vitamin C. The cancer cells selectively take it up. They can't metabolize it like normal cells, turns into hydrogen peroxide, and it can kill them. So that can be a very useful adjunct.
Mm-hmm. Great. So we talked about a lot of information today, and I was just thinking if you can give people your top favorite 5 foods or nutrients. You can kind of go into a little bit if you want about the difference between a nutrient and a supplement, but maybe your 5 or however many you want to pick, best key things for people to eat who have cancer.
Well, if you already have cancer, you want to make sure that you're not getting too much white sugar and white flour. So what I like in place of those, you can have honey, you can have fruit, because fruit has a lot lower glycemic index. A lot of cancer patients are under the mistaken impression they can't have fruit because, it's the same. It's not the same. It has a lot lower glycemic index. There's a good sugar substitute called coconut crystals, which has a lower glycemic index. For breads, I would avoid white flour. I like sprouted whole grain breads, like Ezekiel, because that has enzymes, so that's a lot easier to digest, and you still get the benefit from some of the grains. Same if you're going to have any pasta, go with whole grain pasta like brown rice or semolina or buckwheat. The other thing, the best cooking oils would be like coconut oil or grapeseed oil because they're not damaged by heat. I think people should have olive oil. Every day, olive oil has a lot of very important nutrients, but it's not for cooking with. It's for pouring on, salads or after something has already been cooked. Also, nuts are a very good source of protein, except for peanuts. That sometimes can promote inflammation and can be contaminated with fungus, but I like all the tree nuts, cashews, walnuts, almonds, Brazil nuts. I think people can have chicken, fish, turkey. You can cook with the skin. I'd always make sure you take the skin off. The cruciferous vegetables, the broccoli, Brussels sprouts, cauliflower, cabbage, loaded with anti-cancer nutrients. And then anything with curry in it, anything with turmeric in it. There's one paper I give to patients entitled, "How Many Ways Does Curry Kill Cancer?" It's about 25 different ways.
Fantastic. So you, as an integrative oncologist, spent an incredible amount of time with each patient on their first visit. So maybe so people can get to know a little about a first visit, if you could sort of describe what happens during that typical first visit.
Well, that's usually about 2.5 to 3 hours. And, it's like at any academic oncologist at first. I'm with Cornell. And but I have, my own office, and, everybody says it's like I just keep it very stress-free in there. There's, sounds of, running water, and there's, very relaxing music throughout, literally every inch of that office. So it is a very, very relaxing environment that I've created. I have a lot of aromatherapy and things like that happening there. So even when people are getting their infusions, it's very, very different. But I'll review somebody's, CAT scans, the pathology. I do a lot of work with molecular testing and molecular fingerprinting of the tumors, because we can get huge amounts of information about other types of therapies that may be beneficial. So I'll usually order that on people, because that will literally tell us on a genetic level what the cancer is more likely to respond to or not. So we'll get that arranged. For a lot of people will discuss the therapeutic options, whether it's chemo, whether it's targeted therapy. I do a lot of work with what we call low-dose metronomic chemotherapy, which is really one of the newest things in oncology, because that can be very anti-angiogenic and help cancer cells die normally without a lot of the side effects. So that can be used either for maintenance or after somebody's had a lot of treatment. Then I'll talk with people a lot about nutrition. We do a whole battery looking at vitamin levels, mineral levels, immune function, inflammatory markers, circulating tumor cells, and really talk about what types of nutrients, as far as shakes, as far as, various supplements, that are in freeze-dried powders, things like that, what they can add, because there are certain things like, certain algae, seaweeds, grass juices, mushrooms, you just can't get in a Western diet, no matter how well you eat.
Right.
So we'll talk a lot about that. Some nutrients can be given IV if it needs to be more effective and quicker and in higher doses, like IV glutathione. And then I do a lot of work with people with stress reduction, with meditation, with yoga breathing, with music therapy, and going to see a medical oncologist can be one of the most stressful days of a person's life. Absolutely. And so toward the end of it, I'll teach people certain type of music therapy, and invariably people will open their eyes at the end of it and say, this is the most relaxed I've ever been. And so when you think about it, it's pretty amazing that on the most stressful day of their life, they're the most relaxed.
That's right. Well, I think it's great. One of the most eye-opening statements you made to me on our first visit was, Elyn, if I had met you 10 years ago, likely you would not have had breast cancer. So therefore, if we can prevent cancer, we can use that very same roadmap to help defeat it. So ladies and gentlemen, know that, while you are not responsible for your cancer, you are now empowered to beat and defeat that cancer. So that is a really strong difference, and I think you made a great description of why and the time involved between integrative oncology. People say, oh, it's just so expensive. And you say, yeah, but you're not going for 15 minutes. That's what I try to explain to people. This is not a 15-minute, hi, how are you? Let's take your blood pressure, and there's the door, and continue to take your medicines. It's so much more really to help us defeat cancer and live a very healthy life.
And that's why so many of my patients, literally thousands over the last 25 years, have told me that having had cancer was, in retrospect, was one of the best things that ever happened to them, because they were able to change their whole life, the way they felt, their perspective about their life, how to live each day. So it can actually be a blessing.
In some ways, it certainly can. Nobody wants to have cancer, but it does give you a chance to say, "Oh God!" And typically, people do feel better. They just plain feel better because they've given up a lot of the things that made them sick on a daily basis. They've changed those things, so they feel better. So, thank you, Dr. Gaynor. We're out of time, but thank you for all you do to help all of us who, one way or another, have managed to meet that formidable foe and are eager to defeat him. So thank you for joining us. Thank you for joining us. Thank you. And this has been Survive and Live Well, Tips to Treat and Beat Cancer on Cancer Support Network, W4CS.com, where you can listen live Tuesdays at 1 p.m. If you missed any part of this show, you can catch it on my website, www.elynjacobs.wordpress.com, and you can also replay the links via iHeartRadio Talk. This is your host, Elyn Jacobs, one-on-one cancer coaching, empowering you to treat and beat cancer. See you next week.